do we address the lowest hanging fruit and kind of conceptualize that throughout? Again, not medical advice. I'm sure I'm missing some things, but I'm going to go with the things that I feel like are the lowest hanging fruit and the loudest there. I would recommend first addressing the nutrition side of things and really getting like super clear about what that looks like. When we have inflammation in our body, that's going to be really the culprit that we want to try to address. My suggestion is to look at wherever you can to reduce the inflammation in your body. And we hear a lot about this. That sounds very like, oh, well, like I've heard that a billion times. But specifically, what I would say is find somebody who's like functional medicine who really is going to like get into the weeds with you when it comes to your data, your labs, and all of that. Most doctors will test for CRP, C-reactive protein, which is an inflammatory marker, but there are other markers that you'll get more in the weeds with a functional medicine doctor as well. Getting an idea of your labs in an integrative sense, like to get all of the markers that you can, and a lot of it will indicate gut health and things like that. So you get that data, and then there's the one company I know that does insanely comprehensive tests is Vibrant. They do 2 different tests. Vibrant Wellness is the company, and just like a food sensitivity test complete. They also test for things like additives. If you do the complete, you'll just test everything. Of course, you can do elimination diets. That was basically how I was trained, was to have people do elimination diets. And I think there's a lot of value to it, especially if you don't have the resources to get the testing done. They can be expensive, but the information is so invaluable, especially if you're in like a chronic situation like this. Let's say you are eating all the healthy things, but spinach bothers you. Like this could be, your body could be so reactive to things right now that something random could be inflaming you, and there could be a couple of them, right? So even though they're healthy, like eggs are good for you, but maybe you're having a reaction to it. And it's not that you would avoid these things forever. It's just that you would avoid them long enough for your body to be able to heal, to like your gut lining to heal. You would focus on the gut lining healing portion of things, and then you can reintroduce those foods. But when you start taking out the things that are bothering you, inflaming you, you're going to start to reduce the inflammation in your body overall and reduce your pain. This isn't something that would happen overnight necessarily, but it may happen pretty quickly, and it may take a few months or so. But when you're in chronic pain, like at least when I was in that state, I feel like at least taking steps in the right direction.